Hi everyone, and today I'm going to be speaking about Tysabri. So, Tysabri, a little bit of medical knowledge to my understanding. Tysabri is given to people with active relapse and remitting multiple sclerosis. The purpose of this drug, it's designed to reduce the amount of relapses you have by 70%. Yes, 70%. Amazing. So with this drug, you go into hospital every 4 weeks, you're hooked up to a drip, and that's it. Then you're in hospital for about 3 hours, and then you're on your way. You've had your medication dosage for the whole month, which I thought was pretty amazing, as I didn't really take too well with other disease modifying drugs that I've taken previously. So before you start Tysabri, your neurologist, your MS nurse or your doctor will ask you to go for a blood test to see if you carry the JCV virus antibodies. Now, what does that mean? Right, if you test positive, you carry the JCV virus. And with that, it means with the medication Tysabri, you have a higher risk of contracting PML, which is a brain infection that can lead to death or brain damage. So hopefully that's enough about the medication, and I'm sure if you want to know more in depth about the medical understanding of Tysabri, please do speak to your MS nurse or your neurologist, and they will be able to give you way more information than I can. So my experience on Tysabri. I started Tysabri about 5, 6, maybe 7 years ago. I stayed on the medication for 2 years. So I had my blood test and I tested positive for the John Cunningham virus antibodies. So I was pretty scared. So I made an appointment to see my neurologist and spoke with her and voiced, everything that I was worried and scared about. And she basically reassured me and told me for the first 2 years I was pretty okay. They would monitor me every month when I would go and have my Tysabri medication. So I felt very comfortable to start this medication. So I started this, and every 4 weeks I would go into hospital. I would be hooked up by a cannula and drip for the medication. Before they gave me the medication, they would give me blood tests and make sure I was okay, and if I had any concerns, I could talk to the Tysabri nurse. So the blood test was just to make sure everything was okay. So, I had my medication, absolutely fine. With this medication, I didn't get no side effects. Also, what I really, really, really liked about this medication is that I didn't taste it in my mouth, which was amazing, because I'm one of these people, whenever I get hooked up to a drip for medication, I can always taste this really horrible metally taste, medication-y poison taste in my mouth. So I was really happy that I didn't taste that. So 2 hours of the medication, an hour in hospital for the Tysabri nurse to supervise you and to basically have a good chin wag, and then you're on your way. What I found really good about this medication is that I didn't have any side effects. For the next couple of days, I didn't feel myself, so I felt a bit more tired and a bit more groggy, but that was it. That lasted for about 2 days for me, and then I could just carry on with my life, whatever I was doing at the time, and didn't have to worry until the following month. So I really liked this medication. Now this medication worked really, really well for me, as I was on it for 2 years and I didn't even relapse once, which was absolutely amazing. After my 2 years was up, my chances of contracting PML were much higher. So I decided to come off this medication as I was too worried. My neurologist did reassure me that I would be okay to stay on it for another year, but I just didn't want to. So I decided to come off the medication, and I went down a holistic route, which I'll be talking about in my next video. I hope this has helped you. If you have any questions, please feel free to message me, as I will get back to you and try and help you to the best I can. And thank you very much. I hope you've enjoyed. Please like and share. Om Shanti. Thank you.